Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. I also want to get to 𝗃𝗂𝗧𝗎𝗓's comment because we're running out of time. Hello, my child is 6 years old on the spectrum. He has been receiving speech therapy since he was 3+, but still not using sentences, difficulties forming his own words, lack of social skills. But he goes on to say he's hyperactive, always wants to run, jump around, especially when he, he sees people around. What can I do, please?
Yeah, it's very difficult to try to teach or manage when you have a lot of hyperactivity going on. So a lot of times I really recommend that you try to address the hyperactivity first. And there's a lot of different things to look at there. First of all, what is the diet of the child? So hyperactivity a lot of times has to do with what we're eating. And that could be sugars that are in everything, juice, whatever, foods. And also it could be things that are, for instance, red food coloring. There are certain things that our kids can't digest very well, and it just causes them to be a little bit more hyperactive. You should look at the child's diet anyway and see if the child has really good gastrointestinal health, which is very, very important. Then that aside, is the child sleeping? That when we don't sleep, we tend to have behavior that's kind of erratic. So we will be exhausted, then hyperactive, then exhausted, hyperactive, and it messes with our energy levels, right? Production of energy is really important that it's balanced. So blood sugar, that's the reason I was talking about blood sugar also, is that keep your child on a diet where they're getting food approximately every couple of hours at least, healthy food, so that their blood sugar doesn't go up and down. Now, that sometimes is very hard because we use a lot of sugary items for reinforcers, but try to work on that. So the hyperactivity. Then, of course, you also should actually consult with a psychiatrist or neurologist, because honestly, sometimes the hyperactivity is so intense that if you could, and we're talking about hyperactivity, could also be sensory or ritualistic type behaviors that are interfering. All of those types of things can be somewhat controlled with medication. And if you can get some control over those behaviors, the child is much more aware and awake and ready to learn. So I think that is super important as well. Try to deal with that and not so much trying to fit in the teaching when the child is that active. That being said, another thing that a lot of parents do, or we do on our teams when the child is exhibiting a lot of hyperactivity, is we have very specific sessions of time during the day where we really do active activity, like jumping on a trampoline, running, etc. And we kind of take that energy out during those things. Occupational therapy can often help with hyperactivity if it is a sensory issue. So those are things to think about.
Yeah, Dr. Temple Grandin talks about still in her life having to do a burst of energy at some point in the day to help her to center and focus, which we love. I also want to say, Mohammed, who wrote back in and said the ABA is conducted in the class itself, and you kind of touched on this a little bit, that a lot of times they will tell us as parents that they're doing ABA in the classroom, and Dr. Granpeesheh did address that. Often it's a different thing. Yeah. Because ABA should be, the hallmarks of ABA, it's one-to-one. And it's almost I can tell you it's very unlikely that they're doing ABA in the classroom. They might be using some ABA techniques, but that's different than what we're talking about when we say you got to up the hours of ABA. Okay. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.